Dr. Ronson from Mission Health Center. Today I want to talk about low back pain. It's the number one reason why someone experiences or has to miss work for any purpose at all. Over 80% of Americans actually suffer with low back pain. And the interesting thing is low back pain is created from one of three things. Sometimes it's the bone, sometimes it's the disc, and sometimes it's the muscle. But all three of those will put pressure or can put pressure on your nerve. And when you put pressure on a nerve, it ultimately can lead to pain. So what we do at Mission Health Center is we have to understand and to get down to what we call the root cause of what caused it. So we need to know, is it bone, is it muscle, or is it disc? And so when you first come in as a patient, what we look at is we do a comprehensive examination. We do a case review with you. We want to understand, how did it happen? Now, when it comes to low back pain, it can happen in one of two ways. A lot of times people think of those big macro traumas, like I was working out really hard at the gym and I felt something go pop, or I was involved in a motor vehicle accident where something was shifted out and I immediately was in an extreme amount of pain. But there's also what are called micro traumas, and micro traumas are those things that happen very slowly over time, such as sitting at your desk all day, sitting in a chair, typing at a computer, bending up and down all day long can lead to more of a stress on the joints and ultimately lead to this thing that we call a subluxation, which is a misalignment of your spine causing pressure on those nerves and ultimately leading to low back pain. And we see quite a bit of that. So in our office, what you do, step one, is a case review with one of the doctors. And the doctors will investigate to figure out what was the cause of your ultimate low back pain. Once we know the cause of your low back pain, then what we do is we'll do a comprehensive examination. And in that examination, we're going to look at a couple things. We're going to look at how do you balance your posture. We're going to look at your posture. Do you stand upright or do you slouch? We'll also take you through what's called ranges of motion. And the reason why we do a range of motion study is so we understand what your limitations are. After we've done all of those things, we'll take a set of x-rays. And the reason why we take an x-ray, it's real similar to building a home. If we have a blueprint of your spine and we know what to do and where to do it, it ultimately helps guide our treatment so that you get the best care possible. That's the step number one in our practice, is to number one, understand where's your low back pain coming from, and then ultimately what do we need to do to help it get better. I'm Dr. Ronson from Mission Health Center. We look forward to seeing you on the next video.